Top 30 Certified Nursing Assistant Interview Questions and Answers. Preparing for a Certified Nursing Assistant interview requires more than memorizing common questions. Employers want to see compassion, reliability, communication skills, patient safety awareness, teamwork, and an understanding of CNA responsibilities. In this guide, you will find 30 Certified Nursing Assistant Interview questions with sample answers designed to help you prepare confidently. Practice answering naturally, personalize each response with your own experience, and demonstrate that you understand the importance of dignity, privacy, infection control, and respectful patient-centered care in every interaction. Strong preparation helps you communicate your strengths confidently in interviews. Why do you want to become a certified nursing assistant?
I became interested in nursing because I enjoy helping people feel safe, respected, and comfortable. As a certified nursing assistant, I want to provide dependable daily care while supporting nurses and other healthcare professionals. I understand that patients may be anxious, vulnerable, or uncomfortable, so patience and compassion are essential. I am also prepared for physical work, teamwork, accurate reporting, and maintaining dignity while assisting patients with personal care and everyday activities.
What are the main responsibilities of a CNA?
I understand that a CNA assists patients with activities of daily living while working under appropriate nursing supervision. Responsibilities can include bathing, dressing, grooming, toileting, feeding, mobility assistance, repositioning, measuring vital signs, maintaining cleanliness, and observing changes in condition. CNAs also communicate patient concerns to nurses, protect privacy, follow infection control procedures, and provide respectful emotional support. I understand that duties vary according to state regulations, facility policies, training, and individual assignment.
How do you demonstrate compassion toward patients?
Compassion is important because patients often depend on CNAs during vulnerable moments. I show compassion by listening carefully, speaking respectfully, protecting privacy, and allowing patients to make choices whenever possible. I avoid rushing and explain what I am doing before providing care. Even simple actions, such as remembering preferences or offering reassurance, can make patients feel valued. My goal is to provide safe care while treating every patient with patience, dignity, kindness, and genuine respect.
How do you maintain patient dignity during personal care?
I maintain patient dignity by explaining procedures, closing doors or curtains, covering the patient appropriately, and exposing only the area necessary for care. I use respectful language and avoid discussing personal information where others can hear. I also encourage patients to participate in their care whenever possible, even if they need assistance. I remember that needing help with basic activities does not reduce someone's independence or worth. Every interaction should preserve privacy, confidence, comfort, and dignity.
How would you communicate with patients and healthcare team members?
Good communication means listening carefully, speaking clearly, and confirming that information is understood. With patients, I use simple language, maintain appropriate eye contact, and give them enough time to respond. With nurses and coworkers, I report important observations promptly and accurately without exaggerating or assuming. I also document information according to facility procedures. If I am unsure about an instruction, I ask for clarification rather than guessing. Clear communication helps prevent misunderstandings and supports safer patient care.
What would you do if you noticed a change in a patient's condition?
If I notice a change in a patient's condition, I would remain calm, assess what I can appropriately observe, and immediately report the change to the supervising nurse. I would describe specific facts such as changes in breathing, alertness, behavior, skin appearance, pain, mobility, or vital signs, rather than making a diagnosis. I would follow emergency procedures if the situation appeared urgent. I would also document according to policy and continue monitoring as instructed.
How do you protect patient confidentiality?
I understand that confidentiality is a professional responsibility. I would discuss patient information only with authorized healthcare team members who need it for care. I would never share patient details with friends, family, other patients, or on social media. I would protect records, avoid conversations in public areas, and follow facility privacy policies. If someone asks me for information that I am not authorized to provide, I would politely refer them to the appropriate nurse or authorized staff member.
What steps do you take to prevent infection?
To prevent infection, I follow hand hygiene requirements carefully and at the appropriate times. I use gloves and other personal protective equipment when required, dispose of contaminated materials correctly, and follow isolation precautions. I avoid touching clean surfaces with contaminated gloves and clean equipment according to policy. I also cover coughs, maintain appropriate personal hygiene, and report exposure concerns promptly. Consistent infection control practices protect patients, coworkers, visitors, and me from preventable transmission.
How would you safely transfer a patient?
Before transferring a patient, I would review the care plan and instructions, explain the procedure, ensure the environment is clear, and use appropriate equipment. I would lock wheels, position equipment correctly, use proper body mechanics, and ask for assistance when required. I would never attempt to transfer beyond my training or the patient's abilities. During the transfer, I would communicate clearly, move slowly, and watch for weakness, dizziness, pain, or loss of balance.
How would you handle a difficult or agitated patient?
I would approach a difficult patient with patience rather than taking the behavior personally. First, I would listen and try to understand whether pain, fear, confusion, frustration, or another concern is contributing to the behavior. I would speak calmly, offer reasonable choices, and maintain appropriate boundaries. If safety becomes a concern, I would follow facility procedures and seek help immediately. I would also report significant behavior changes to the nurse so possible causes can be evaluated.
What would you do if a patient refused care?
If a patient refuses care, I would respect the refusal while making sure the patient understands what care is being offered and why it may be important. I would remain calm, avoid arguing, and ask whether there is a concern I can address. I would inform the supervising nurse about the refusal and follow the care plan and facility policy. I would document the refusal accurately when required. Patient autonomy should be respected while maintaining safety and professional communication.
What does teamwork mean to you as a CNA?
Teamwork means communicating openly, respecting each person's role, helping coworkers when appropriate, and keeping patient safety as the shared priority. I understand that CNAs work closely with nurses and other healthcare professionals, so reliable communication is essential. If I notice a coworker struggling, I would offer appropriate assistance when possible without neglecting my own responsibilities. I also accept feedback professionally and avoid workplace gossip. A supportive team creates better coordination and a safer environment for patients.
How do you prioritize tasks during a busy shift?
I prioritize care based on patient safety, urgency, scheduled responsibilities, and changes in condition. I review my assignments, identify time-sensitive tasks, and organize activities efficiently while remaining flexible when unexpected needs arise. I do not sacrifice essential safety steps simply to work faster. If several needs occur simultaneously, I communicate with the nurse and ask for direction when priorities are unclear. Staying organized, documenting appropriately, and completing tasks systematically helps me provide consistent care throughout the shift.
Why are observation skills important for a CNA?
Strong observation skills are important because CNAs often spend significant time with patients. I pay attention to changes in appearance, behavior, appetite, mobility, communication, skin condition, breathing, mood, and routine. I report objective observations to the nurse promptly rather than interpreting them as a diagnosis. I also compare current observations with the patient's usual condition when that information is available. Careful observation can help the healthcare team identify concerns earlier and respond appropriately.
How would you take and report vital signs?
I understand that vital signs provide important information about a patient's condition. I would follow my training and facility procedures when measuring temperature, pulse, respirations, blood pressure, oxygen saturation, or other assigned measurements. I would use appropriate equipment, ensure accurate positioning, record the results correctly, and report abnormal or unexpected findings promptly. If a reading seems inaccurate, I would follow policy for rechecking it. I would never ignore concerning results or independently diagnose a condition.
How would you help prevent patient falls?
Preventing falls begins with identifying risks and following the patient's care plan. I would keep pathways clear, ensure appropriate footwear, place needed items within reach, and follow instructions for mobility assistance. I would use prescribed assistive devices correctly and respond promptly to call lights. I would also avoid leaving a high-risk patient unattended during activities requiring assistance. If I observe new weakness, dizziness, confusion, or unsteadiness, I would report it promptly to the nurse.
How would you assist a patient with bathing and personal hygiene?
I would approach bathing and other personal care tasks professionally and respectfully. Before starting, I would explain the procedure, gather supplies, provide privacy, check water temperature appropriately, and encourage the patient to do whatever they can independently. I would protect the patient's body from unnecessary exposure and observe skin condition for changes. I would report concerning findings according to policy. Personal care is not simply a task, it is an opportunity to provide comfort, dignity, and reassurance.
What would you do if a patient fell?
If a patient falls, I would stay calm and immediately follow facility emergency procedures. I would not move the patient unless there is an immediate danger requiring movement and policy or emergency guidance permits it. I would call for the appropriate assistance, observe the patient's condition, and report what happened accurately to the nurse. I would not make assumptions about injuries. After the situation is addressed, I would complete required documentation and incident reporting according to facility policy.
How do you help prevent pressure injuries?
Pressure injury prevention requires regular attention to skin condition, positioning, nutrition, hydration, mobility, and the patient's care plan. I would assist with repositioning as directed, keep skin clean and dry, reduce friction and pressure during movement, and use support surfaces or devices appropriately. I would observe vulnerable areas for redness, discoloration, warmth, swelling, or breakdown and report concerns promptly. I would never massage an area that appears injured unless specifically instructed by an authorized healthcare professional.
How would you assist a patient with eating?
I would provide feeding assistance patiently and according to the patient's care plan. I would verify the correct patient and diet instructions, position the patient safely, encourage independence, and offer food at a comfortable pace. I would watch for coughing, choking, difficulty swallowing, fatigue, or other concerning signs and report them immediately. I would respect preferences and avoid forcing food. Accurate intake observations should be recorded when required because nutrition and hydration can significantly affect recovery and well-being.
What does professionalism mean to you?
Professionalism means being dependable, respectful, honest, and prepared for every shift. I arrive on time, follow policies, maintain appropriate boundaries, protect confidentiality, and complete assigned responsibilities carefully. I communicate respectfully even during stressful situations and accept constructive feedback without becoming defensive. I also understand the importance of appropriate appearance, hygiene, and workplace behavior. Patients and coworkers should be able to trust that I will perform my responsibilities safely, consistently, and with a positive attitude.
How do you handle stress during a busy shift?
Work can become stressful when patient needs change quickly, the workload is heavy, or unexpected situations occur. I manage stress by staying organized, focusing on immediate priorities, communicating with the team, and following established procedures. I avoid letting frustration affect the way I treat patients or coworkers. If I feel overwhelmed or uncertain about a task, I ask the appropriate person for guidance. Remaining calm helps me think clearly, maintain safety, and provide compassionate care.
What would you do if you made a mistake?
If I make a mistake, I would take responsibility immediately rather than hiding it. I would ensure the patient's immediate safety, inform the supervising nurse or appropriate professional, and provide accurate information about what occurred. I would follow facility procedures for documentation and reporting. I would also reflect on why the mistake happened and identify ways to prevent it from happening again. Honesty and prompt reporting are essential because patient safety must always come before personal embarrassment.
How would you handle a conflict with a coworker?
I would handle disagreement professionally by listening first, clarifying the issue, and focusing on patient safety rather than personal opinions. If I made an error, I would accept feedback and correct it. If I believed a concern could affect patient care, I would respectfully communicate my perspective and involve the appropriate supervisor when necessary. I would never argue in front of patients or allow conflict to interfere with care. Professional teamwork requires respect, communication, accountability, and a shared focus.
How do you provide culturally sensitive care?
I understand that cultural sensitivity means respecting differences in beliefs, communication styles, traditions, food preferences, family involvement, and personal routines without making assumptions. I would ask respectful questions when appropriate and follow the patient's preferences and care plan. If I do not understand something important, I would seek guidance rather than relying on stereotypes. Every patient deserves equitable, respectful care.
What is the most important part of patient safety?
Patient safety is my first priority. I would follow the care plan, facility policies, infection control procedures, fall prevention measures, and instructions within my scope of practice. I would use equipment correctly, report changes promptly, and ask for help when a task requires additional support. I would never perform a procedure I am not trained or authorized to perform. I believe safe care depends on attention to detail, clear communication, proper documentation, and recognizing when to seek assistance.
How would you respond during a medical emergency?
I would respond to an emergency by staying calm, protecting the patient from immediate danger when possible, activating the appropriate emergency response, and following my training and facility procedures. I would communicate clearly with the nurse or emergency team and provide accurate observations. I would not attempt unfamiliar procedures outside my training. After the emergency, I would complete required documentation and cooperate with the team. Remaining composed and following established protocols can help protect the patient and support an effective response.
How do you encourage patient independence?
I would encourage independence by allowing patients to perform tasks they can safely manage while providing assistance only where needed. I would offer choices, use adaptive equipment appropriately, and give patients enough time rather than rushing them. Independence can improve confidence and dignity, so I would avoid doing everything for someone simply because it is faster. At the same time, I would follow the care plan and recognize safety limits. Supporting independence means balancing encouragement with appropriate assistance.
Why should we hire you as a CNA?
I believe I would be a strong CNA because I bring compassion, reliability, patience, communication skills, and a serious commitment to patient safety. I understand that excellent care involves both practical skills and respectful human interaction. I am willing to learn, accept feedback, follow instructions, and work cooperatively with the healthcare team. I would treat every patient as an individual and remain attentive to their comfort, dignity, and changing needs throughout each shift.
What are your career goals as a CNA?
My goal is to become a dependable healthcare professional who consistently provides safe, respectful, and compassionate patient care. As a CNA, I want to strengthen my practical skills, learn from experienced nurses and colleagues, and build trust with patients and families. I also hope to grow professionally through continued education and experience while remaining committed to my responsibilities. Most importantly, I want every patient I assist to feel respected, heard, comfortable, and cared for. A successful CNA interview is an opportunity to show that you are dependable, compassionate, safety-focused, and ready to work as part of a healthcare team. Review these 30 questions, practice your answers aloud, and prepare examples from your training, education, volunteering, or work experience. Remember to communicate honestly and confidently without exaggerating your skills. Employers value CNAs who respect patients, follow instructions, notice important changes, and remain calm under pressure. With preparation and a caring attitude, you can make a strong impression and demonstrate commitment to quality patient care.